We get calls at least one or two a week where someone calls up and they don't have any health insurance and they're feeling sad, depressed, a lot of things going on in their lives, and they just want help and they just want to know where to go for help. And obviously our first question is, do you have health insurance? Do you have Medicaid? Do you have any ability to pay? And if the answer is no, it makes our job very difficult. The only places that we've been able to find to get services are either if you're homeless, if you're imminently suicidal, need to be Baker acted. If you're in Duval County Jail, there's services right away there. But just for a general person who doesn't have health insurance and is an adult and needs services, needs to have a psychiatric evaluation, possibly psychotropic medications or counseling, there's nowhere for them to go. And the wait lists, even if you do have have any kind of health insurance, are 2 to 3 months long. But there's not many places, there aren't really any places to go just to see a psychiatrist, get the medications, get ongoing counseling, ongoing treatment. They just aren't in Jacksonville. It would have to be very large. It would have to be a very big building because we have one of the highest percentages of uninsured adults in the state of Florida. Our percent of uninsured adults is about 25%. And so if you look at then a fourth of them probably have some sort of mental health condition, you're looking at thousands and thousands of people who would be showing up. And so it would have to be very big, have to have several psychiatrists, therapists, case managers, to not only help them in their crisis situation, but to help them with ongoing care, be resourceful to help them get the medications that they're going to need. They can be quite costly. Counseling, we always recommend getting some sort of counseling in conjunction with the medication therapy. And so it would have to be a very large building, very well staffed, very well funded, but it would be an amazing resource for this community. People with a mental illness, they don't want to live like that. It would be like, wanting to have diabetes or wanting to have cancer and having cancer and not wanting treatment. That's just not the reality. People with mental illness, they want help. They want to feel better. They don't want to feel this way. But unfortunately, they don't have the resources to get the care that they need and get the treatment that they need. And so they continue to struggle. And our society doesn't allow people with cancer to not get the treatment that they need, but we allow people with a mental illness to not get the treatment that they need.